This is a short presentation about preparation for your placement assessment for Year 2 student nurses. So, as we know, student nurses have been invited to volunteer in practice as part of the national response to the COVID-19 emergency. So, degree nurse apprentice students and sponsored students, we call them direct entry students, they've been in placement for a little while and you're being expected to return to your place of employment, but you still hold student status. And the NMC have launched temporary emergency standards. So this means that whilst you're in practice, you won't be supernumerary, but you will be working under a contract of employment and be paid by a health provider organisation. Whilst you're not supernumerary, it's important that you will be supervised under the direction and delegation of registered nurse in line with Clause 11 of the NMC Code, but there are going to be times where the supervision is more limited, so you wouldn't be getting the full experience and opportunity to develop skills in a placement that you have done as a student. So any student who started the programme in December or January, as you haven't had an assessment in practice, you are going to be assessed using the modified COVID EPAD. Any student who has not been assessed in their first placement, for example, due to extenuating circumstances, or didn't pass placement 1, professional values, then will require assessment using a modified COVID EPAD. Those of you that require assessment have all been emailed with a guidance document explaining how to go about your assessment process. So whilst you're in placement, you will have a practice supervisor, so you'll be working with registrants, you will have a named practice assessor, and you will also be supported by an academic. So practice supervisors are registered nurses, registered nursing associates, midwives, or other registered health and social care professions. That can include doctors, physiotherapists, etc. Because they have the knowledge of their scope of practice, they are able to support you, they supervise you, serve as role models, provide feedback, and they also have support for their. So your named practice assessor is a registered nurse. They confirm the assessment in order for you to move into Year 3. They'll be seeking feedback from others on how you've done, making sure that they are properly informed about how you've been working with the team. They are linking with your academic assessor to review progress, and if there is any situational problems or issues they have with you, then they will be contacting the academic assessor and a joint action plan between the three of you will be drawn up. Your academic assessor then is a member of the teaching team. You will know who your academic assessor, their name appears on your EPAD, and they will just make sure that the processes take place and that support you if there are any concerns about your practice. So the professional values is the NMC code. When you open your EPAD, they will be itemised thus: 4 areas that are expected to be demonstrated by you during your placement for you to be assessed as meeting these requirements. So normally you would be undertaking episodes of care and medicines management assessment. However, if the workload permits, you can have a formative assessment, be given feedback to get a gauge of how you are, where you are, so where you need to start for Year 3. Formative means rehearsal or dry run. There are guidance documents and there are also performers that can be used on the EPAD site, and the other presentation shows you where those are. It is formative, it's not a formal assessment, it is not a final assessment. It is in order for you to gain feedback on how you would do if you were undertaking the assessment. For example, there are 2 episodes of care in year 2. It is up to you, but it's looking at complex care needs. And again, depending on the care setting you're in, depending on the type of patient groups there are, you can work towards meeting those. Medicines management needs to be, again, carrying out that medicines administration, and some of you may be in placements where this isn't suitable, and this is another reason why we are not expecting you to be assessed formally. Just a point, if you do this, you need to demonstrate a minimum of 3 calculations. Again, there are 60 proficiencies for year 2 and 3 that will be need completed by the end of the programme. It does depend where you are, it depends where the opportunity is, but also it's important that the situation in terms of the supervision that you're receiving is different than expected of a student normally. Then there may not be opportunities for you to be supervised and to be assessed at proficiencies, but if the opportunity arises, then you are able to take that opportunity. So please refer to the guidance document that you've been sent. Share that document with your assessor so that people know what you are being assessed on and what needs to be done.